I will officially start our webinar today. My name is Ana Garcia. I am affiliated to the Pontificia Universidad Católica Madre y Maestra, commonly abbreviated as PUCMM, and I am the currently Secretary of IADR Caribbean section. Today, in this webinar, we would like to share our research highlights of our dental school at PUCMM in Dominican Republic. And in this opportunity, we have a professor from the University of Puerto Rico, Professor Boneta, who is going to share with us some insights and reflections as well. The whole webinar will be conducted in English. Although English isn't our native language, we believe that it's worth the effort for better understanding with the audience and for a greater reach. All right. Right. First of all, I would like to bring a message from our president of IADR Caribbean section, Professor Arvind Babu Santosh. And he says, greetings to the webinar participants and members of the IADR and IADR Caribbean section. It is with great pleasure and anticipation that I welcome you to another insightful session of our Research Highlights webinar series. This webinar marks our 8th webinar activity in IADR Caribbean section. This platform continues to serve as a beacon of cutting-edge research, fostering collaboration and advancing oral health across the Caribbean. I am delighted to extend a warm welcome to our distinguished colleagues from Pontificia Universidad Católica Madre y Maestra, PUCMM. Having Professor Augusto Elias Boneta as our guest of honor adds a unique touch to this session. Sincere gratitude to Dr. Brenda Ogando for moderating, and a special acknowledgement for Professor James Collins and Professor Natalia Grullon for their coordination efforts from PUCMM. A high salute for Dr. Garcia for representing IADR Caribbean section from the Dominican Republic and leading the coordination of this webinar. As we engage with the research findings and insights presented today, let us continue to celebrate the spirit of inquiry, innovation, and shared commitment to advancing oral health research. The scientific highlights from PUCMM promise to contribute significantly to our collective knowledge and further strengthen the bonds of scientific collaboration in our region. Together, we are building a brighter future for dentistry in the Caribbean. Thank you for your active participation and valuable contributions. Respectfully yours, Professor Arvind Santosh. All right. With these opening remarks, I will review briefly our today agenda. Today we have Professor Brenda Ogando, who is moderating. She is an associated professor from our dental school at PUCMM at PUCMM, and she will introduce our guest of honor and our speaker today. And I would like to remind the audience that I'm attaching a link of Google form at the chat for you to fill it at the end of the webinar. And a participation certification from IADR Caribbean section will be sent to you via email. So I'll now turn the word over to Brenda Ogando. Brenda. Let me see. Okay.
Thank you, Dr. Anna, for the introduction. It's a pleasure to be here. Now, I want to welcome our guest of honor, Professor Augusto Elias Boneta, who is a distinguished person in the field of dentistry, having pursued an illustrator academic and research journey, graduating with a BS in biology from University of Puerto Rico in 1969. He went on to complete his DMD at UPR in 1973, followed by an MSD in dental materials at Indiana University, Indianapolis, in 1975. His remarkable achievements culminated with the conferral of Doctor Honoris Causa, DHC, at the University of Costa Rica in 2009. Since 2004, Professor Boneta has held the position of Assistant Dean of Research at the School of Dental Medicine of the University of Puerto Rico. In this role, he has played a pivotal part in administrating a multi-staff research office and fostering research activities for faculty, graduate students, and dental students. His dedication is further evident in his roles as principal investigator and project director of NIH grants, mentorship of postdoctoral students and young faculty, and contributions to health disparities research and social determinants of health. His involvement extends to the Hispanic clinical and translational research education and career development program, where he has served on the internal advisory committee since set in 2013. Beyond his institutional roles, Professor Boneta has been driving force in creating the Caribbean Oral Health Initiative, a network dedicated to promoting and supporting research in health disparities and capacity building activities in the region. His key research contributions, Professor Boneta's impact is not only reflected in administrative roles at UPR, but also in his substantive contribution to dental research. His flagship projects, including dental caries disparities and associated risk factors in Puerto Rican children, and periodontal health and risk factors in Puerto Rico, and oral cancer detection in Puerto Rico, showcase his commitment to addressing critical oral health issues. His extensive publication record and numerous scientific presentations underscore his commitment to advancing the field and fostering the next generation of researchers. We appreciate having you here, Professor. Welcome.
Thank you, Dr. Ogan. Saludos. I would like to thank Dr. Arvin Babu and Dr. James Collins for this kind invitation to speak with you all today. I am truly honored to present on oral health equity, the role of academia, and will focus on oral and general health equity and the challenges in moving towards its goals. I will also share with you some of the approaches that the University of Puerto Rico School of Dental Medicine is following to reduce oral health inequalities or disparities in Puerto Rico. It's a concise reflection of a complex and urgent problem. We've been talking about oral health disparities as part of a global movement to solve the differences in health among segments of different groups of people within and between countries. Yet, the results have been minimal. The report put forward by the WHO Commission on Social Determinants of Health in 2008 represented a consensus among the international participants and eventually became a foundational text for how crucial social determinants are to health and health equity. A strong change in direction from the dominating biomedical paradigm was clearly established with the results of this meeting. Yet, as manifested in this commentary by Rasana-san, published in The Lancet in 2018, health and possibilities of achieving health equity have been hard hit by austerity policies, resulting in stagnating life expectancy and widening mortality rates in many countries. There has not been a widespread policy uptake of the recommendations to improve the daily living conditions, to tackle the inequitable distribution of power, money, and resources, and to monitoring both inequities and the impact of policies to address them. In oral health, the burden of oral disease is increasing, particularly in low and middle income countries. Oral health continues to be neglected in the global health agenda. On a positive note, a historic resolution on oral health was proposed at the WHO World Health Assembly in 2021, with the development of a comprehensive global strategy on oral health. It put forward a vision for universal health coverage of oral health services by 2030. In summary, in 2008, the WHO approached health inequality within and between countries by focusing on social determinants of health. The actions recommended in the final report were three. 1, improve living conditions. 2, fight against the unequal distribution of power, money, and resources. 3, measure the magnitude of the problem, analyze and evaluate the effects of interventions. This last one is clearly a responsibility of governments and the academia. Where are we now? In 2003, more than ever, the persistent socioeconomic inequalities in oral diseases require a firm commitment to the 2008 recommendations made by the Commission on Social Determinants of Health. As reiterated during the 2021 WHO Global Oral Health Status Report, a paradigm shift in oral health policy and planning from the conventional model of restorative dentistry towards promotive and preventive model is required, with oral healthcare interventions included in the universal health coverage. We, at the School of Dental Medicine in Puerto Rico, discussed and approached this issue. First, the Academic Senate of the Medical Sciences Campus discussed the challenges of the social determinants of health and approved a proposal to integrate and strengthen the topic throughout all the activities of the 6 professional schools, including the School of Dental Medicine. Since 2012, the UPR School of Dental Medicine incorporated objectives and activities related to social determinants of health interprofessional education into its strategic plan. Its mission would eventually be revised to emphasize the oral health equity agenda. By 2017, the UPR School of Dental Medicine revised and incorporated in its curriculum the social determinants of health. And the Office of the Assistant Dean of Research established a research and equity analysis unit. As a result of these activities, we have experienced a transition from the dominant biomedical model that reduces health to biological and genetic factors, and from the lifestyle approach of the behavioral model that basically makes people responsible for their own health and generally widens the oral difference between population groups according to the capacities and opportunities. The gradient that we see in oral health echoes the gradient of society's socioeconomic differences. We have learned that improvement in dental visits, oral hygiene practices, reduction in sugar consumption, tobacco, and alcohol consumption are not reasonable options for high-risk individuals unless we consider and act on the social environments in which health behaviors are developed and sustained. The social determinants agenda highlights the influence in health of the social conditions in which people are born, grow, live, work, and age. This is the social determinants of health conceptual framework adopted by the Commission on Social Determinants of Health in 2010. The School of Dental Medicine adapted said framework in our revised curriculum and guides us in our research activity to understand oral health inequalities in Puerto Rico. It helps appreciate the novelty of the Commission approach as a multi-level design that considers complex causal pathways that link individual characteristics, such as sex and age, with intermediate determinants, such as poverty and the structural influence of the socioeconomic and political consent. I will mention now some examples of the research and action that the School of Dental Medicine has engaged in the past and is presently developing research questions based on social determinants. But before I do this, I will present some socioeconomic data on Puerto Rico that presents a picture of the context in which we are working. As you probably know, Puerto Rico is located in the most eastern area of the Greater Antilles in the Caribbean. In 1988, it became a U.S. territory. Our heritage is African, Taino, and Spanish. The predominant language is Spanish, with English as our secondary language. There are 3 million people living on the island with a poverty level of 46%, which is 3 times higher than the US. We have been suffering a deep recession since 2006. The unemployment rate is 6.2%, and the labor force participation is 44.4%. The School of Dental Medicine organizes its research activities through the Office of the Assistant Dean of Research. Our mission is to advance the search for scientific knowledge, promoting collaborative, scientifically meritorious research and scholarly activities to impact oral and systemic health, reduce oral health disparities, study the social determinant of health, and promote scholarly activities for faculty and students. Responding to the paradigm shift in the health sciences and the disparities in oral health in Puerto Rico, we established a research and equity analysis unit highlighted in our organizational chart, directed by a doctor in public health with a special in social determinants of health. Its purpose is to promote and conduct research oriented to reduce the oral and related health disparities in Puerto Rico through collaborative efforts against and actions on the social determinants of health. The objectives of the unit are generate knowledge that improves dental and general education, the development of health professional and ethical practices, develop health policies, regulations, and interventions that seek outcomes that result in greater equity. The unit will achieve this objective through strategies directed in 3 action areas: disease disability prevention, healthcare, and public policy. Now, some examples of our research in health disparity are, as mentioned previously, the oral health status of 12-year-old Puerto Rican, the first epidemiological island-wide study that revealed a health disparity between children attending public and private schools. Public and private school in Puerto Rico is a proxy for socioeconomic status, where children in public school from lower income families presenting a significantly higher DMFT score. 10 years later, the study was repeated, and after a health reform was implemented, the gap in dental caries had increased between public and private schools from 9% to 30% gap. A second study that we conducted, a deficit in biopsying potentially premalignant oral lesions in Puerto Rico, perspectives on one healthcare practitioners, and the detection deficit in oral premalignant and early cancers in Puerto Rico. Our analysis is that there is a shortfall in biopsy, potentially precancerous oral lesions in Puerto Rico, with oral lesions suspicious of oral cancer, pre-cancer, likely to be biopsied only after developing an invasive oral cancer. Then we went to focus groups and key interviews and asked for genetic examination findings from the focus group with general dentists in Puerto Rico and perspective of San Juan healthcare practitioners on the detection deficit in oral premalignant and early cancers in Puerto Rico. So went from the lab to the patient, to the dentists in Puerto Rico and requested information on why they think that we were having this detection deficit in our premalignant lesion in oral cancer, which is hazardous to our patients, and then it shortens the life expectancy of our population with oral cancer. Participant interviewed and agreed to a need to train dentists to increase the quantity and quality of oral cancer screenings. The School of Dental Medicine has also played a central role in the policy-making process to enact laws and establish regulations to advance the oral health agenda in Puerto Rico. For example, Law 40 from August 1993 is amended as a result of actions of different sectors to regulate the practice of smoking in public and private places. The School of Dental Medicine played a leadership role to compel owners, administrators, or heads of regulated places to guide their employees on the scope and justification of provision of the law in coordination with the Tobacco Control Program and the Assistant Secretary for Environmental Health of the Department of Health. Law 63 of August 3, 2017 establishes regulations for the requirement of an oral exam certificate as a condition for minors to be admitted or enrolled in public and private schools. It is mandatory to present evidence of an oral and prophylaxis exam certificates in the grades of kindergarten, 2nd, 4th, 6th, 8th, and 10th grade. On a separate note, the fluoridation law in Puerto Rico was passed in 1997-98. However, up to now, we haven't fluoridated the drinking waters of Puerto Rico. So all is not in the positive direction. We need to work more with fluoridation law to make it happen on our island. We are working on a project to provide input in design and implementation of new admissions formula for our School of Dental Medicine, geared to the inclusion of students that are in good standing, but also are sensible to the needs of the Puerto Rican population and have concepts of compassion, altruism, diversity, and respect. We have revised our curriculum to include concepts related to the central determinants of health. Central topics were integrated in relevant courses of the first-year curriculum and elective courses included in the research courses. New research on social determinant of health that we're planning to conduct are a theory-based qualitative content analysis study on the implementation of the social determinant of health curriculum at the UPR School of Dental Medicine. We're going to evaluate ourselves. Violence-induced maxillofacial trauma research, a collaborative transdisciplinary project to address its social economic determinants of health, and social determinants of food insecurity, a case study of families that visit the pediatric clinics in Puerto Rico at the UPR School of Dental Medicine. Finally, I would like this short presentation with a quote from Dr. Richard Watts that states, "Any action on reducing social inequalities in health requires active social participation and community empowerment. Once again, oral health professionals need the skills, experience, and insights to enable them to work effectively with communities as local oral health champions and advocates for change." Again, I will thank you all for your kind attention today, and I would personally like to extend an invitation to anyone who may be interested in exploring potential collaboration opportunities with our university.
Thank you very much, Dr. Boneta, for your assertive and inspiring presentation. The research career is challenging, and even more so in Caribbean and Latin American countries, we still have a long way to go. We are encouraged to have professionals like you to continue opening path and give our contribution to research in dentistry in overall health in the Caribbean. Now, I will proceed to introduce our speaker today, Dr. Johannes Olsen, who is a professor and member of the Dental Research Committee in the Pontificia Universidad Católica Madre y Maestra, Dominican Republic, Santo Domingo. Graduated from dental school at the Universidad Católica Tecnológica del Cibao in 2012. Then in 2007, he made his master in periodontics and oral implants at the Pontificia Universidad Católica Madre y Maestra, PUCMM. This year, 2023, he started his PhD at the University of Sao Paulo in health science with a concentration in oral biology. His positions are clinical and theory professor of periodontics since 2014 at PUCMM, graduate thesis advisor at School of Dentistry since 2017, co-advisor of methodology in graduate thesis at School of Dentistry, member of the Dental Research since 2022, member of the Dominican College of Dentists in Santo Domingo. And also, he has published in 2018 a study titled In Vitro Microbiological Analysis on Antibacterial, Anti-Inflammatory, and Inhibitor Action on MMP8 of Commercial Available Chlorhexidine Mouth Rinses, and Indiana Journal of Dental Research, and several posters in the field of dentistry. We appreciate having you here, Professor. Welcome.
Thank you very much, Dr. Brenda. Good morning. It's a pleasure for me to share some of the highlights we have achieved here at the Pontificia Universidad Católica Madre y Maestra. I'll go ahead and share my presentation. Just a second, please. Please let me know if you can see my presentation.
Yes.
You can see it.
Thank you very much. Perfect. So I am very humble and I'm very grateful for the invitation by the IADR and also the university in order to, well, let you know some of the things we have been doing lately. So before we start, I would like to let you know a little bit, give you a little bit of background of history of what we call PUCMM, which is an acronym for Pontificia Universidad Católica Madre y Maestra. So if you hear me saying PUCMM, I'm referring to the university. And this is just to give you some context. The PUCMM is located in the Dominican Republic. Our very next neighbors are Puerto Rico, Haiti, Cuba, and Jamaica. And we have two campuses. Our campuses are located in Santiago de los Caballeros, which is in the north part of the island, and also in Santo Domingo, which is the capital city of the Dominican Republic. The Santiago campus was founded in 1962, and it was also started with the School of Dentistry. And later on in the year 2003, we started with the graduate dentistry programs. On the case of the campus of Santo Domingo, this was founded in 1981, and it was not until 2010 that we have the establishment of the Health Sciences faculty, starting with the School of Dentistry, and later on the School of Medicine also joined us. On the year 2013, no, not very far from there, we started with the graduate dentistry programs. We currently have about 16 research and innovation laboratories that are located between the two campuses, 7 on Santiago and 9 on Santo Domingo. On regards to research, this is our general organizational director. I will just highlight the Vice Rectory of Research and Innovation. All of the researchers go through this part, and we're part of this. Just to give you an idea, since we have a very large population of students, we do have 2 different directors for the School of Dentistry on each campus. We have for the campus of Santiago, Dr. Elba Estrella. In the case of Santo Domingo, we have Dr. Natalia Grullon. We also have graduate programs coordinators that oversees, let's say that way, all the graduate programs. In the case of Santiago, it's Dr. Lugan Corniel, and Santo Domingo is Dr. James Collins. So let's go ahead and go into the presentation itself. Just to give you an idea, I'll be talking for the two different programs. I will start with the undergraduate program first, and then we'll go ahead and talk about the graduate program. So in regards to the undergraduate school, we work with a competency-based learning process where we teach the student the process one by one and how to do research. And how do we start with the research in this part? We have what we call the 3 subjects that are called or named research in dentistry 1, 2, and 3. They usually start at the 2nd year of the pensum. And through this process, what we do is that we teach them the basic parts of the scientific method. Here they learn how to elaborate a question, how to make an objective, how to develop that proposal, later on present that to the scientific community. So every final research project is one person job. It's a collaboratory effort guided by senior academics within the school, very similar to what we saw with Trinidad and Tobago. Our research projects cannot end on a drawer. We say that if you do not let everyone know what you've done with your research, it's a dead research. So every final research project ends with a contribution. And how do we try to encourage the student to do so? Well, first of all, every time every group finishes, they have to write an abstract of their job in Spanish and English. And why is the reason of this? Usually we would have some invitations during the year from national and international events and national and international institutions to have oral presentations and poster presentations. So we encourage our students to get involved into this and also share what they have found through this process. Some of the topics of research in their undergraduate school are oral microbiology, epidemiology of periodontal diseases, also endodontic diseases. We also have been working with patients with special needs, periodontal therapy, and also the evaluation of dental materials. I will just go ahead and show some of the events where our students have been contributing with this researches. For example, the Student Congress for Scientific and Technological Research held by the Ministry of Education, where our students had oral presentations. We also collaborated and participated on the first IADR Caribbean section that was held also here in the PUCMM in 2019, where our students were able to share part of their contributions. Now I would like to highlight here, part of this is international collaboration in the undergraduate program. This was directly with Dr. Patricia Palma from the University of Chile. She's the head of the oral microbiology area there. And she came here and collaborated with us for this. We also have participated in the National and International Dominican Congress of Dentistry, held by the Dominican College of Dentists. And also with other national universities, such as La UAS, in the first International Congress of Research, Development, and Innovation. This one is very recent. This was on October of this year, where our university had what we call the PUCMM Research Week. In this, the university, especially the Vice Rectory of Research, tried to encourage the students to present the best final research projects of the last 2 years. And with this, also have a prize. That will encourage them to not only get involved when they finish, but also try to come after they finish and collaborate with the university. Part of the presentations also went with prizes. So going towards the graduate programs, we currently have about 5 programs. We have the Master in Periodontics and Oral Implants, Master of Prosthodontics and Oral Implants, the Specialty in Endodontics, Master in Pediatric Dentistry, and also the specialty on TMJ disorders and orofacial pain. It's a requirement, it's a requisite for each student that will graduate from this program that they have to do a research. That is a non-negotiable. And the reason for this is to first encourage, but also help them to promote. We understand that when we have the students in our hands, usually the one who has more experience on the field is the one who leads, but also the one who encourages and guides through the process. So we have this collaborative effort with all the professors, guiding the student to finish their master program with a research. And this also it's presented in oral presentations, poster presentations, but overall what we like the most is index publications, which is one of the final goals. So what is very important about these two programs, especially the programs related to periodontics and oral implants and prosthodontics? These two programs share at least 20 subjects in between. And that's one of our most important points, because these students, no matter which program you're coming from, you will have a whole perspective of how to see the patient, how to see the patient, and how to work on an effort as just one team, and not individual. So part of the lines of research are also intricated one with the other, such as microbiology, epidemiology and risk factors for periodontal diseases, periodontal therapy, surgical protocols, biomaterials in oral implantology, and CAD/CAM studies. It's very important to say that this cannot be done alone. And for us, collaborations and networking, it's a masterpiece. It's something that we always look forward. Part of the collaborations we currently have with international institutions are University of Chile, the University of Tennessee, Knoxville, Stony Brook University, University of Puerto Rico, West Indies University, University of Alfonso el Sabio, Universidad de Sao Paulo, y the University of Complutense de Madrid, also as Institute of Milan. And what we do with this interinstitutional collaborations? Well, besides directing research, we prepare the students to not only work in one place and see the things just one way. With these collaborations, we can learn from other practices. We can learn from other countries. We can see how we can improve. And some of this will also, for example, be calibration exercises in order to do some researches in particular, or not only work in our facilities, but also translate to other facilities outside of the Dominican Republic, as the University of Chile or the University of Tennessee, Knoxville. All of this also goes ahead with poster presentations. And part of this are the IADR London presentation on team, where part of our graduate students presented their final research projects. Also, the IADR Canada section on 2019. And of course, the National International Dominican Congress of Dentistry. Here, they do not only present the poster, but also had oral presentations. So all of this ends up with some of our accomplishments and contributions that are index publications, one of our main goals. And some of them, we can see it just here, like microbiology. In the case of gingival microbiological profile of periodontitis patients in the Dominican Republic. And some others with regarding to the epidemiology of periodontal diseases, such as the Caribbean-based multi-center study on the prevalence of disparities linked to smoking and gingival health. Periodontal therapy. Some surgical protocols. And also related to biomaterials and oral implantology, and many other publications. These are just a few of the index publications we have made so far in collaboration, not only with the local universities, but also international universities. So one of the questions we usually have is, where does the funds and grants comes from? We have three main places: the private sector, the public sector, and the university, the PUCMM. On the private sector, as you may know, many of the sponsorships would come from laboratories or different entities that will collaborate either with materials or grants. Also, in the Dominican Republic, we have what we call the Fondo Seed. The Fondo Seed, it's our national funds for research, where you can submit your research, and it opens annually, so you can every year you can submit a different research, and if you earn the prize, you can go ahead and do the research. In our case, we have earned some national funds, and we have done investigation with it also. And part of the investigations also comes from the university funds. Here, I would just like to show you some scientific publications that you can find on Scopus and Shimago. And what you will see here, these two lines, the red line means Fondoset. This was established on 2006. I'm sorry, 2005. And we had established the Vice Rectory of Research and Innovation on 2006. So you can see how the red line goes up, starting with the national funds, and also the blue lines start rising as it goes through the years. You can see how it goes up on the year 2013 when part of the publications comes from the dentistry school. This is an overall presentation of the publications of the university, but many of them comes from the School of Dentistry, being this like 15% of the national publications. So what are our next plans? What are we looking for? What are we walking to? Well, we're looking forward to another two programs that will open here soon: Master in Orthodontics and the specialty in cosmetic dentistry. One of the best news we had this year is that we started with the first PhD program in health sciences and, of course, dentistry of the Dominican Republic. This under direct collaboration with the University of Sao Paulo. Part of the authorities started this agreement a few years ago, but it was not until 2023, this year, that we could start this. And you will see here part of the students are that we're cursing this PhD program. All of the ones you see in here are professors from the university, each one of them, and they'll be doing research in different topics such as endodontics, forensic dentistry and collective health, oral biology, periodontics, laser, and many others. Part of the process was to visit the Faculty of Dentistry in Sao Paulo, which was this year, where we had the opportunity to also do part of the process of learning, but also known some of the locations we'll be working in, such as the oral biology laboratory and the biotarium, as you can see in here, and also the laboratory of a scan electronic microscope. All this is very important because our students, or us as the students, will be traveling back and forth from Brazil, and we'll be having these researches between that university and also here. And what I see in here is that we also plan to have part of this works in the molecular biology and nanosciences laboratories that are in our country. With this also came some of student mobility agreements for the undergraduate school, the School of Dentistry, where our student will be able to do student mobility with the University of Sao Paulo, but also with the Pontificia Universidad Javeriana, which is from Colombia, where our students will be able to either stay a minimum of 1 month or 1 year, and all the credits will be recognized. So they will not lose their time during the process of traveling one place or the other. It's very important for us to mention that we've been collaborating with Caribbean universities, specifically the University of Puerto Rico and the University of West Indies, particularly the Campus Mono. And we have been working together with at least locations lately. On regards to the national ground, part of the researches that we're doing right now is we're trying to measure the literacy level of oral health in nurses of the maternal and child hospital, Doctora Evelina Rodriguez, which is a national hospital. And we're trying to see the level of literacy, but also how to improve that. This is a collaboration with the Dominican College of Dentistry, the COI, Caribbean Oral Health Initiative Network, another local university, the Universidad Nacional Pedro Enrique Ureñas, and International University, Universidad de Chile. This goes to not only see this in here in the Dominican Republic, but see how we can replicate this information, how we can improve the literacy level of oral health in the nurses, not only in the Dominican Republic, but also in Latin America. We are also currently working with another local university, Universidad Iberoamericana, in the evaluation of periodontics programs in the different undergraduate programs of dentistry here in different Dominican universities, in order to see and evaluate how are we teach periodontics and see how this not only connects with the Dominican Republic itself, but also with Latin America. Very important. We're also working with the government of the Dominican Republic. We're currently having what we call the ENASA, which is a research regarding the overall health of the Dominican population. And the three main goals are nutrition, medicine, and dentistry. So basically, we're starting with the population of Santiago de los Caballeros and Santo Domingo. This is an undergraduate research program that we're doing right now with the collaboration of the Ministry of Health. And last but not last, I will also like to provide you some of the information. So just one moment, perfect. Of what we're doing here with internal collaborations with the School of Engineering, specifically the School of Mechatronics. This building you see right here in my picture is shared with the Faculty of Health Sciences, but also the Faculty of Engineering. And we're having collaborations in order to see and work in application of AI for the diagnosis and prognosis of periodontal diseases. We're also in the process of patenting an instrument that can allow us to harvest in a remote and non-invasive way autogenous graft from the palate. We're also working on the patent for impression traits for neonates with cleft lip and palate. And finally, we're designing a digital model that identifies the different clinical characteristics of TMJ disorders, and also that could suggest some different treatments. We do understand that every great job cannot be done by just one single person. And for that reason, we understand that collaboration is very important. I finish here, leaving you my contacts. We're more than glad to, I'm sorry, just one second. We're more than glad to do collaboration and networking with you. So if you're interested, please feel free to reach us either through our email, or also you can find more information in our webpage. Thank you very much for your time.
Thank you, Dr. Olsen, for presenting us the research highlights of PUCMM. Our hope is to continue working on the dental research field, and the purpose is the students and our professionals acknowledge the importance of research and that we can continue growing little by little in this field. Dr. Anna, you can continue.
Thank you, Professor Brenda. Well, I'm delighted. I'm excited. It's been a great morning today. Thank you, Professor Bonetta and Professor Olsen. There was excellent presentations, both. Now we're going to start the question and answers session, either for Professor Bonetta and for Professor Johannes Olsen. You can write it in the chat and I will read them, or you can open your microphones and feel free to ask. Does anyone have some questions? Well, in the chat, Dr. Ramos said, excellent presentation. Thank you. Let's see.
I would like to share some thoughts.
All right.
Yes. I would like to congratulate Dr. Olsen and all the members of the PUCMM. I've been there, I know your projects. But I have one question for you. We receive a lot of students from the Dominican Republic for the graduate programs, for the international program. And so we learn about your research that you require from all your students. And we try to copy you, but the problem we had is that we didn't have enough mentors for all our students, both in research and concept. How do you manage that situation, or how can I improve that situation?
Well, thank you very much for the question. That's a very important question. We'll, as many of you know, and I will actually just expand a little in there. You know that sometimes as Latin American countries, we lack of resources. So we have to work what we have in our hands. I cannot say that this is, as I said in the beginning, this is just not one person job. Many of the professors here collaborate directly. When we elaborate the research project for each group of students, we find a specialty professor, a professor that is directly connected with that subject in particular. If it's prosthodontics, we find a professor from prosthodontics that can help us there. And we do dual collaborations. We have the methodological part, which I'm part of, and we guide the students through the process just to make sure that every step is achieved. But also we work with directly with the other professor to just make sure that the information is new, that the information is important, and that's the way we work. We do collaboration directly. Many of these professors do it by their own will, and that's how we do it. How we have been doing it so far. So they collaborate directly with their knowledge.
Thank you, Doctor. But do you have specific lines of research that you bring students into them, or is?
Okay, so for the graduate programs, we do. The graduate programs do have different, like a specific line. On regards to the School of Dentistry, we work more, as you probably saw, I put their topics because we usually develop the teams. We're currently working towards to work with a line of research, the one that I presented that is working directly with the government of the Dominican Republic, the health ministry. That one is a line of research that we're starting this year, and is to like oversee and check off the overall oral health of the population. We're starting by there.
Yeah, that's very important. Epidemiological studies is of utmost importance, actually, to identify the disparities and then work on them. It's very important. So congratulations again for all your good work.
Thank you very much.
Thank you, Dr. Olsen. Thank you, Dr. Bonetta, for your contributions. Well, the chat is full of congratulations on both doctors for your presentations. Dr. Aquil said he will be happy to engage and collaborate in the artificial intelligence research. So welcome, Dr. Aquil. We are glad to collaborate with you. Dr. Vincent Tosh, raised hand. Doctor, you can.
Yes.
Yes.
Thank you, Dr. Gush. It's an excellent presentation from Dr. Olsen here. Dr. Olsen, it's nice to hear that you had incorporated a new technology and new emerging artificial intelligence in your research path. So as you said that it's a collective effect, can you just share with us about that what the type of research that you're trying to do in there, because I do understand that you're trying to do something on diagnosis aspect of periodontal research. Can you just give us some of the sharing points, or like how does it work out? We'll be glad to hear that.
Sure. So this part is directly been worked by Dr. James Collins and the graduate program. What they're doing, we're starting the process with the School of Mechatronics. The thing is that we're trying to see through the AI the patterns of periodontal diseases and see how we can prevent and do some prognosis. We have been working with different kind of prognosis for several years, such as Walker-Caton or McGuire. And so how about we can just start using these special tools that we have in our hands and see if this can not only provide us with the diagnosis and prognosis and see, but also to see how can this be like precise, how precise can it be? Right now is evaluating different variables and then like, I'm sorry, I'm just trying to find the words in English.
Yeah, that's right.
But and how to create or elaborate this prognosis and based on these variables that we already have using the AI.
That's good to know about it, because it's a state of art, and then the modern generation, they must be liking these type of research. You're trying to be not only up to date but also to the future, and I really appreciate for that. And Dr. August actually stole my question. I had the same question too, like how do you maintain the mentor? But you answered it. Thanks a lot.
Thank you very much.
Thank you, Dr. Garcia, and thank you, Dr. Window.
All right, does anyone has another question? Let me see the chat. Well, since we don't have, we don't have more questions.
Oh, yes, sorry, I will just interrupt just real quick. I will put my email on the chat. If you'd like to reach us, we will be glad to have information from you. And so we can direct you to the right channel. So I will just leave my email there. If you'd like to reach us, we'll be more than glad to do so, okay?
Thank you very much, Dr. Olson. Please.
Excuse me. I would like to remind the group that in January, Puerto Rico is going to present the highlights research. I think it's on the 24th of January, so we're looking forward to see you all there. Specific projects will be presented.
Thank you.
Thank you, Dr. Augusto, for that.
We are going to meet there on January. Thank you. Well, Dr. Olson, did you put your contact in the chat? Yes. All right. Since we don't have more questions, I would like to remind all the audience that I just paste a link in the chat, a Google form link for you to fill it. There's a few questions and a little survey, and then you just write your name and your email, and participation certification of the IRDR Caribbean section will be sent to you, to each of you, via email. And I really want to thank you again.